Hi, my name's David. I'm one of the founding partners of myPhysioSA here in Adelaide. Today I want to talk to you about back pain and what you can do about it. So you have back pain and what's actually going to help it. It can be pretty confusing to know what to do when you've got back pain that's just not going away. You've had it for some weeks and it just doesn't seem to be getting any better. What can you do besides take painkillers and rest? Well, here's some physio tips that's going to really help you get started on getting moving again, helping the pain and trying to settle things down and get back to life again. So if you've got low back pain, it could be coming from a lot of different spots in your back or your spine. About 80% of back pain is classed as non-specific low back pain, which basically means us health practitioners and GPs find it really hard to exactly pinpoint what part of your back the pain might be coming from or what structure it is. That being said, there's a few patterns for low back pain and we'll run through what they are and then what's best to help each of those things. So the causes of low back pain can vary a lot. Some people find that with their back pain they can't sit or bend, or coughing and sneezing hurts. Other people find they actually don't like standing or walking or being in an upright position. That makes their pain worse, and sitting actually helps it. So the exercises and advice for each are quite different. So some people actually have a bit of both. They don't like sitting or standing, and especially in the acute or early stages of back pain, you'll find that doing a few minutes of anything will be enough to start to aggravate it. So my key physio tips for helping back pain is firstly, get moving. So the old advice used to be bed rest, take it easy. Once it stops hurting, then you can try and get up and start moving. Well, we found that that's definitely not good advice. We need you to be doing things as you can tolerate and get moving. The more you lie around or sit and don't move, the stiffer and tighter you can get, and the more it often feeds into your pain. So get moving. The trick is get moving, but pace yourself. So don't go out there and do all those aggravating things or things it doesn't like and push through the pain. That's not going to help you much. You've got to actually pace yourself with your activities and make sure that the pain doesn't build up to high levels, and rest when you need to, but make sure you keep as being active as a normal lifestyle as you can be. The next piece of advice is to lessen the aggravating activities. So that could be driving the car for long distances. You might have to stop and have regular breaks, get out and move and stretch before you continue on. Sitting in your office chair, you might have to have a little timer that you set every 20 minutes to get up and get moving or doing some of the stretches. With work, where it's a manual type job, you'll just have to be smart about planning your day, just doing little bits of activities here and there that your back might not like, so you're not doing a whole morning of it. The same with housework or other activities at home. You need to pace out what you do. If it's vacuuming that aggravates your back, well, try and get someone else to do it, or just do a room at a time, pace it, just do a little bit here and there. My third tip is start doing more things that make it feel good or make it feel better. So there will be some stretches I'll show you in a minute, and you can start trialing some of them. If they make you feel looser, freer, less pain afterwards, start doing more of them. Building them up slowly as tolerated, but you've got to start doing things that make it feel better. So exercises are one thing, using heat packs. Some people prefer ice on their back, getting into a warm bath, hot shower, basic pain medications like your Panadols or something that's a general anti-inflammatory can help reduce some of the pain to let you get moving sooner. So the advice I'm about to give is good advice to people with low back pain. If you're also suffering from a lot of leg symptoms, that might be pain travelling down your legs, sciatica, through to pins and needles, or numbness or even weakness, then these exercises probably aren't going to be the best for you, and you might have something a bit more serious going on. And it definitely needs to be checked by your GP or your physio first before you tried any of these exercises. So now I'm just going to run you through some basic exercises. So if you're got the sort of back that doesn't really like sitting, bending, then I'm going to demonstrate a couple of exercises that should help loosen and free up your back and help to start to settle down your pain. And you need to start these nice and gently and build them up. So this stretch here is to help release tension in your lower back. So if your back doesn't like sitting or bending, this can be a very good exercise because it's going the opposite way and it can give a lot of relief. So I'm just propped up on my elbows and relaxed here on my forearms, and you stay here for up to 2 minutes as long as there's no pain in your back or discomfort, especially if it's building and increasing, you stop straight away. Otherwise, it should actually feel nice and comfortable. Keep all your muscles in your back relaxed. If you get to the 2 minutes that it's nice and comfortable, you can actually finish with 10 pushing up onto your hands for a few seconds and lower back down, and you repeat that as many times as comfortable, up to 10, making sure there's no pain in your back as you do it. So this exercise is just gentle rocking with your knees to loosen off all your back muscles and try and get the spine moving again. Bend your knees up, feet together, and just gently rock each way, slow and steady, making sure there's no pain in your back. It's just a nice stretch happening. And you rock slowly for about a minute, and you can make it go a little bit further side to side as it feels looser and easier to do. This next stretch is to stretch tightness through the back of your hip, through your glute muscles. You bring one knee up, grab your ankle and bring your knee up and across, so you're pulling your knee towards the opposite shoulder. You should feel a stretch in your buttock. Again, you hold this for a minute and you shouldn't have any pain in your back. So now I'm going to show you some exercises if you have the type of low back pain that doesn't let you stand or walk, or is easily aggravated when you're sort of arching or more upright. So this exercise is just gentle rocking with your knees to loosen off all your back muscles and try and get the spine moving again. Bend your knees up, feet together, and just gently rock each way, slow and steady, making sure there's no pain in your back. It's just a nice stretch happening. And you rock slowly for about a minute, and you can make it go a little bit further side to side as it feels looser and easier to do. This one here is to stretch out the tight muscles in your back. You bring one knee up and then the other knee, and you'll feel a gentle stretch in your lower back. And if it's feeling comfortable, you can bring your knees up higher and higher and get a better stretch. The idea of this is to loosen off any muscle spasm or tightness in your lower back. And you can stay here for up to a minute, and then once you're finished, you can drop one knee down at a time. If you have the sort of back pain that's not really letting you do too much of anything, whether it's sitting or standing or walking or bending, you really doesn't want to budge too much, then these are the exercises that you need to follow. And to start them very gently, they should feel very comfortable to do. If there's any increase in pain during or afterwards, you need to stop them straight away and come and seek our advice. So this exercise is just gentle rocking with your knees to loosen off all your back muscles and try and get the spine moving again. Bend your knees up, feet together, and just gently rock each way, slow and steady, making sure there's no pain in your back. It's just a nice stretch happening. And you rock slowly for about a minute, and you can make it go a little bit further side to side as it feels looser and easier to do. And the next stretch is to stretch the back of your leg. You bend one knee up, support your thigh, straighten up to wherever you're comfortable. This is to stretch your hamstring and any nerve tension that you might have from your back, to help release it through there. Again, don't want any back pain while you do it, just want to feel a nice gentle stretch in the back of your leg. And you hold it for up to 60 seconds. This next stretch is to stretch tightness through the back of your hip, through your glute muscles. You bring one knee up, grab your ankle and bring your knee up and across, so you're pulling your knee towards the opposite shoulder. You should feel a stretch in your buttock. Again, you hold this for a minute and you shouldn't have any pain in your back. So this video is about explaining about what you can start doing right now to help your low back pain. One of the things that we like to do is check to see if someone's deep core muscles are working properly, their support muscles for their back. And that's actually a vital thing if you want to make sure that your back gets back to full function, full mobility, full use, and stays that way. So your deep core are muscles that support your spine and make sure it's protected and supported while you're moving, bending, lifting, twisting, playing sport. So if you want to know more about how to bring your core on and make sure it is actually working and start to do some exercises for it, check out the link below and you can watch another one of our videos that explains about how we actually check for if your core is working using our diagnostic ultrasound machine, and how you can get started on some exercises. And there's also a special offer of a gap-free assessment if you want to get started on them.